Why you need pelvic floor physical therapy after having a baby. Hi, welcome to our Ed Talks, little snippets of education to help you heal and feel empowered. I'm Justine Calderwood, pelvic floor physical therapist and certified birth healing practitioner. Today, I want to talk to you specifically about a term that I've learned from Lynn Schulte at the Institute for Birth Healing. And she talks about the common birth patterns or the open birth pattern. And today I want to dive in a little bit more because this is not well known and it's a big reason why we see so many women after having their babies here at the Healing Spot, and why I urge you to see a pelvic floor physical therapist that knows this information. So we're going to dive in deep on what are the common birth patterns, why they develop, and what can be done about them. So let's get started. Before we go over what the common birth patterns are, I want to talk a little bit about what happens in the pelvis and how it needs to move during labor and delivery for a vaginal birth. Okay, so I'm going to show you with my little model here, the little baby, and this pelvic model. So in the first part of labor, as baby is working his or her way down, what happens in mom's pelvic bones is we have to accommodate and open up so baby's head can get into this area. Now, typically baby will come down, head down, ideally, and typically in a position where the back of the head is facing towards the left pubic bone, okay? And baby would be then looking towards this part of the pelvis. So we call this the pelvic inlet. So as baby works his or her way down, what needs to happen here is that this needs to open up in this direction with the bones here that open up laterally or to the side. And then the base of the sacrum moves backward. And what happens then is that widens that space for baby's head to get in. And then baby does some rotations and kind of flexion of the head in order to work his or her way down a little bit further. Well, in the second stage of labor, this needs to actually open up. Otherwise, that would be really narrow and would be hard for baby to come on out. So in the second part of labor, the sits bones here underneath need to open up this way, and the tailbone or sacrum moves back into flexion. So that widens the space and baby can come on out. So with the common birth patterns or open birth pattern, basically just says that these bones may end up staying open or in a pattern that's still conducive for labor and delivery, even after baby is born. And this can lead to some problems in mom's body, which we're going to dive in right now. So some common things that might happen, there may be some imbalance here at the pubic bone. So mom might experience some pain into the pubic symphysis even after birth. Now this happens a lot of times during pregnancy as well, just due to imbalances in mom's body, how baby is resting in position, and maybe prior injuries or traumas, things like that. However, if it persists afterwards, it may be part of the common birth pattern, stemming really from how baby comes down and possibly rubs on the backside of that pubic bone. Another thing that can happen is that the sits bones here, the ischiums, they may actually be spread open a little bit more, okay? And they may be symmetrical, meaning both might be open, or it may be asymmetrical, where maybe one is splayed open or just open to the side a little bit more than the other side. Another thing that could happen is that the tailbone here, the sacrum, may still be in that flexed position or open. Or you might even get a combination of any of that, where you have the ischiums that are open and the tailbone back like that. And this is leading to a lot of openness up underneath or even asymmetries. So why would that matter? What might you experience with that? So what are some of the symptoms that you might experience with this? For some moms, they just feel pain anywhere along this pelvic area. So it might be pain in the front, like I said, in the pubic bones. It might be pain in the back, so lower back or even a little lower, top of the buttocks. It might even be underneath into the coccyx, so really low. It might be hip pain or what we'd call like pelvic pain out to the side. For some moms, they tell me they just don't feel like they can sit level. Like they'll try to sit on the floor to play with their kids, and they just feel like their bones aren't sitting level. The pelvis is not level. Sometimes people tell me they just feel different. Something just feels off. I've had women even tell me that it feels loose, it feels open, kind of feels vulnerable, especially if they do something like move quickly or with coughing or sneezing. And I'm not just talking about urinary incontinence, although it may be tied to that. I'm talking more about almost like an instability, like something just doesn't feel like it's supported up underneath them. Some other signs or symptoms may be pain with intercourse, so especially with insertional pain or pain with penetration that wasn't there before, something has changed. You might even experience changes in bowel or bladder function, so and there may be leaking of urine or feces or even gas where you can't hold things back. It might feel like an urgency, a sense of needing to get to the bathroom right away, whether that be because of your bowels or because of your bladder. It could also be a feeling almost like a prolapse where the organs just don't feel like they're in the right place, or you feel a sense of heaviness, bulging, or pressure, either lower abdomen or even down into the lower pelvic region. Before I get to what we actually do about this, I'm going to tell you a little bit about what we do here at the Healing Spot for treatment. I want to just give you another visual here because I've shown you the bony model, but I want to now layer on what it looks like on the bony model with those structures. So as we look down here from the front, you can see behind the pubic bones, we have the bladder, the uterus, and the rectum. And then if I take them out, you're going to appreciate the muscles of the pelvic floor inside. So you can see the deep pelvic floor muscles, how they create kind of a bowl or a sling or a hammock in there. Okay, and they attach onto the inside part of the pelvic bones and they continue back onto the coccyx and that sacrum. And if I flip this over, you're going to appreciate the muscles that are a little closer to the surface of the skin. This would be if a woman were lying down on her back, face up. You can see the vaginal opening there and the rectum. And you can see how these muscles come and they fan out to those sits bones. They come up to the pubic bones and they wrap around here. So you can see the deep pelvic floor muscles underneath. If I take that off, you can see that a little bit better. And then you can see the more superficial muscles layered on top. And I will say this is broken. I dropped it one time, so forgive that. It's not asymmetrical like that. Anyway, can you imagine if we were to layer that on, right? And we have maybe one side that's open a little bit more or both sides open or the tailbone pressing back towards the back side, how that could then really alter how much support there is underneath here for those organs that sit on top, also for the function and the ability for those muscles to do the job that they're intended to do, which is to hold back stool and urine as well as gas, and to provide a lot of support for not only the organs, but for the pelvis itself. So that's why it can lead to a lot of pain and some other dysfunction that I mentioned earlier. I want to quickly just say the reason that this happens, maybe we don't know all the reasons that it might happen. I mean, there's so many different ways or reasons for, a particular woman to have the open birth pattern, but it can be related to mom's position and alignment during pregnancy as well as right before birth. It can have to do with baby's position in the uterus, how straight down they come, and if they come in at an angle, or how they present in that first part of labor and how they kind of work on down. It can also be related to previous injuries, traumas, and events in mom's life that has caused some of that imbalance. And then I will also say it can be related to positions during labor and delivery. So, for instance, I just want to point out if you were to labor and deliver your baby lying on your back, which is very typical in a hospital setting, although it's not just in hospitals, but a lot of hospitals encourage this type of labor and delivery where mom is on her back and we have one person on either side holding the legs. Can you imagine if one side is a little tighter or if somebody's pulling a little bit more, how that might lead to some imbalance there? Also, this sacrum can't move as well if mom is on her back and it's resting against a bed. So what has to happen are these bones have to move more against gravity. And again, some of this can be related to just mom's imbalance in her body. But I just want to point that out that that's very common to deliver in that way. And that's why we can have some of this imbalance. Great. So if you got this far into the video, you're learning all kinds of new things. You're probably at this point wondering, what do we actually do about this? Okay, Justine, it makes sense. Everything that you've said so far, what do we actually do? Well, for treatment, that's where our expert therapists here at the Healing Spot come in. And what we do is we assess to find out what exactly is going on in your body. This is one area that we look at is mobility, alignment of your pelvis. We do that with you standing as well as lying down in different positions. We would check it on your back, on your side, on your stomach, so that we can get all the way around here. And we would even, a lot of times, we check in the labor and delivery position. So let's say we have a lot of moms that like to deliver at home or in the birth center or even the hospital. But we would ask them, what position were you in when you pushed baby out? Because that can really help us to also check that position to see if some of these common birth patterns are present. And what we do then is we find out first what's going on, we find that baseline information, and then we use that information to tailor a customized treatment approach for you. A lot of times we use our hands and we help very gently to get those bones back closed, the pelvic bones closed back down. We nudge them in a way in order to allow better mobility as well as get them back in the position where they need to be. And it is a very gentle treatment approach. The other thing that we do, we can teach exercise related to this and ways that you can actually help yourself at home. But again, we need to start with assessment and finding out that baseline information on exactly what your body needs, because not everybody presents the exact same way. The other thing that I want to just point out too is that here at the Healing Spot, we look at you as a whole person. So although I've really mentioned a lot about the pelvis today and the organs and a very specific part of the body, you're more than just your pelvis. So when you come into the Healing Spot, we look at you as a whole person. So when we do that standing assessment and we're putting our hands close to you or on your body in certain ways, we're really feeling into what is your body wanting, what's going on, and what does it need. So in that assessment of you as a whole person, we're going to take into account that you just had a baby, right? And so we know when you're pregnant, a lot of changes happen, a lot of postural changes, for instance. So just take it into effect that a lot of the organs have been pushed up kind of out of the way to make room for baby. So lungs get kind of shoved up, the liver on the right side and the stomach on the left side, those organs kind of move and get shifted to make room for baby. And so one of the things we do here at the Healing Spot is we address that. We look at how well are you moving up into your chest and your upper back, not just the low back. We also feel into those organs and we do some very gentle visceral mobilization for those organs so that you can feel like you can finally get a good breath in again and that you're not everything isn't all like squished up and jammed up in there. That makes a big difference for your nervous system, for how you feel, and how well you can heal after having your baby. I want to finish this video just by inviting you to reach out to us here at the Healing Spot if you are interested in having an assessment and finding out what's going on with your body, especially if you're experiencing some of those symptoms that I mentioned earlier. I also just want to say that this type of information really is unique to the Healing Spot. We're located here in Colorado Springs, and I will say this is the type of education that we do with our patients, and it's the education that our therapists know. But I will say it's very unique to our style of delivering postpartum care. You're not going to find this down the street in other clinics. And so, for that reason, I really urge you to take your health seriously. Reach out to us here at the Healing Spot. The best thing that you can do is head to our website. That's healingspotpt.com. Pick whatever option works out the best for you. But I invite you to sit down with one of our therapists in a discovery session. It's a free session where you're going to be able to tell us your story, tell us what's going on, and get our expert advice. And you can do that without even committing to care yet. It really is a free session for you to find out more on how you can help heal. So head to that website, and thanks for watching this Ed Talk. We will see you on the next one.